early in 2021 when I was making plans to step away from work. I left the hospital after a pretty routine hospital shift, and I collapsed in front of the hospital. I couldn't make it to my car in the parking lot. I found a tree to lean against and found an assistant from the emergency room who had a wheelchair to help me get to my own car. The wheelchairs are used to bring patients from the hospital to their cars. I made my way home, and that was the last time I was able to practice anesthesia. I thought I was stressed out. I thought I was burned out, but the reality was I likely had a post-viral illness that is now called long COVID or post-acute sequelae of COVID, which is the formal word for it. I had long-term sequelae of a COVID infection. Most likely I got from working on the front lines.
Welcome to the Well to Lead podcast, where we explore the dynamic relationship between personal wellness and effective leadership. Dr. Zeest Khan, how are you this morning?
I'm doing great. I'm so happy to join you, Bobby.
Oh, fantastic. And listen, I am happy that you are here. I have been waiting with anticipation for our discussion today, Dr. Khan, and I really appreciate you taking time out of your busy schedule to come on the Well to Lead podcast today to provide some insight into long COVID and chronic illnesses. I'm sure a lot of people out there are going to be very interested in today's discussion. But before we get started on the path, Dr. Khan, if you could take a moment and just tell our audience a little bit about yourself, and we'll get rolling from there.
Sure, I'd be happy to. I'm Dr. Zeest Khan. I am a physician in Northern California. My specialty has a very long name. I am an adult cardiothoracic anesthesiologist, which means I take care of people undergoing open heart and lung surgery. I trained at Stanford and worked in Silicon Valley for several years after my training and moved closer to my hometown near Sacramento, where I am right now. I have two lovely kids and a wonderful husband, and my life was spectacular. I was seeing a lot of the fruits of my hard work and labor. And then in 2020, the pandemic hit. I live in an area of the world that was hit very hard by COVID, and I worked on the front lines with all of my colleagues and teammates. And I developed a respiratory infection. I get a lot of allergies. We're in the agricultural area here in Northern California, so I didn't think too much of it. And then everything changed. Work was really busy. It was very stressful. I specialize, Bobby, in the most high-tech, high-intensity medicine there is in the hospital. And I was seeing things I had never seen before on the floors. People were very, very sick in the hospital. And then I noticed I was feeling unwell also. I was dragging. It was hard to breathe. I was having a lot of respiratory issues. I was finding myself sitting a little bit more. I was finding myself not able to walk up a flight of stairs anymore to get from the main floor to the operating room.
Wow.
I was taking the elevator for the first time. I was really struggling. But I pushed through, even though my health was changing, because I wanted to show up for my community. I wanted to be there with my colleagues, taking care of the people who needed us. As frontline workers understand, it's a big responsibility that we take seriously. But by the end of 2020, my health had deteriorated. And in 2021, early in 2021, when I was making plans to step away from work, I left the hospital after a pretty routine hospital shift, and I collapsed in front of the hospital.
Wow.
I couldn't make it to my car in the parking lot. I found a tree to lean against and found, an assistant from the emergency room who had a wheelchair to help me get to my own car. The wheelchairs are used to bring patients from the hospital to their cars. I made my way home, and that was the last time I was able to practice anesthesia.
Really?
I was sick. Yeah, I was really sick, and, to make a longer story not much longer, I thought I was stressed out, I thought I was burned out, but the reality was I likely had a post-viral illness that is now called long COVID or post-acute sequelae of COVID, which is the formal word for it. I had long-term sequelae of a COVID infection. Most likely I got from working on the front lines. My career and my life has been completely changed. And as my health has improved, I've pivoted to trying to help people as a doctor in a new way to help people understand complex illness, um, and utilize the healthcare resources that we have, which are not perfect, but to use them as well as they can.
I guess once you realized what was happening, um, the condition of long COVID changed the dynamics of what you could do as it pertains to practicing medicine,
Yeah.
essentially. Okay. So I'm sure most people have probably heard of long COVID. Can you give us something, perhaps maybe in layman's terms, as to what that actually is? And is there a huge percentage of people that you know of that are still dealing with that?
I would be happy to. I've spent the last few years since falling ill learning how to translate my medical language
Yeah.
into what I call normal language, normal English. So I'm going to try to do the same here. Long COVID is a new condition, but it's not really a new condition. It is in the family of poorly understood long-term chronic illness that occurs after typically a viral infection, but can occur after a bacterial infection or sometimes a trauma. So, what we understand about long COVID, you can think about it as kind of similar to mono. We have the idea of a college kid who gets mononucleosis, which is a bacterial infection, and I'm sorry, a viral infection, and is in bed for months and has a lot of fatigue and is tired. That's considered an infection-associated chronic condition, IACC. Long COVID is also an infection-associated chronic condition. We have the initial viral infection, which presents like a cold or like a flu, and then once that subsides and someone typically, resolves those symptoms, they start to feel better. Typically, after a couple of weeks, what can happen is the person can develop a new set of symptoms that can be really puzzling. A lot of times, it is presents as profound fatigue, and it's not the type of fatigue that is like I'm really sleepy, although it could be. It's not the type of fatigue that you feel after you've worked out in the gym. It's almost like you are walking through water, against a current, like you have concrete shoes on. You just don't have any energy stores to push through. Think about a marathon runner at the end of a marathon, but you feel that with as someone with long COVID after you walk through your house. There are over 200 symptoms that have presented after a COVID infection that become chronic. And people with long COVID have any number of combinations of those symptoms. But typically, we see fatigue. We can see respiratory issues like new or worsened severe asthma, um, something called post-exertional malaise, where even the smallest, exertion can leave you feeling like you worked out in the gym real
Yeah.
hard,
Yeah.
and it takes several days to recover from. and something called dysautonomia, where your autonomic nervous system, that part of your body that controls your heart rate, your breathing, your blinking, things that you can kind of control, but that happen automatically, that autonomic nervous system, which is divided into sympathetic and parasympathetic systems, a lot of people might understand or recognize those terms, it goes out of whack. It starts malfunctioning.
Ah,
That nervous system helps control your blood pressure. So when you go from lying down to standing up, you don't pass out. Well, after a COVID infection, a lot of us go from lying down to standing up and then we pass out
mm,
because that nervous system has malfunctioned. So there's a lot of other symptoms that can present, but essentially it is a set of new conditions that last a very long time after an acute infection, in this case, COVID.
okay. Um, is this something that this doesn't sound like it's permanent, or is it? Or could it be?
That's the $1,000,000 question. So, millions of people are affected by long COVID in the United States. Over 400,000,000, it's estimated, are affected worldwide. And different people have different access to healthcare resources. There is healthcare inequity that really contributes to the likelihood that you're going to get better. But some people do get better within a year or two. They start having their symptoms resolve. But for some people, like me, the condition lasts for years. And for others, we don't know yet, but it may be a long term, lifelong condition that might get better. But that's something that you're going to have to manage for the long haul.
To I guess to know or to find out if you have long COVID, you would first need to find out that you had COVID, right? So, assuming.
Well, yeah, that would be great. The problem is we don't have great testing for COVID.
Okay,
I When I got sick, we did not even have any available COVID, tests. Those were reserved for people who those were developing, first of all, and they were reserved at that time in the spring of 2020, and even in the end of 2020, 2021, for people who were hospitalized and severely ill so that doctors could target therapy knowing exactly what the patient had. But for many of us, we don't have a diagnosis of COVID. And so we have a presumed infection. And you can still be diagnosed with long COVID with a presumed COVID infection.
okay. Now, is this is long COVID, um, is it in the same category or is it classified as a chronic illness like any other?
Yeah, it is likely a chronic illness. It is uh, categorized by Social Security in the U.S. as a cause of disability, and it's likely a chronic condition.
Okay. Okay, got it. Got it. So your life's disrupted.
Mhm.
You didn't know exactly, it sounded like at the beginning you wasn't really sure what was happening. Can you maybe talk to us about the moment you discovered what you were actually dealing with and kind of maybe take us back there into that space of what you were actually feeling and perhaps maybe dealing with once you discovered that that's what this was long COVID.
Sure. Well, even before that, I want to point out and acknowledge that a lot of us are in denial that we have anything going on, especially those of us who think of ourselves as high achievers and really independent. I've been a caregiver my whole life. I am not used to being someone who needs help. And I want to point that out because I took a long time before I admitted to myself that anything was even wrong. I just said, "No, I'll deal with this. This is just something temporary," and the temporary went on for a long time. So I think it's really important to acknowledge that it's hard to be humbled
Yeah.
by our bodies.
Yeah.
Um, And it's also really important to listen to our bodies. So, it took a while for me to get diagnosed with long COVID because that definition was evolving as my symptoms were evolving too at the same time. Now it's a little bit more on the radar for many physicians. Not enough, but for many physicians and many people in medicine recognize it. But I will tell you what when it hit me that something was really wrong. I remember trying to walk to the pharmacy to pick up my prescriptions, and I couldn't get from the front door of the shop to even, like, a few steps. I was about to just sit on the floor in the middle of the Target, but I
Wow.
found a bench,
Yeah.
and I was like, "This is" finally hit me, I was like, "Okay, this is not in my head. Something is
Something's
wrong."
wrong. Yep.
And I think that's the starting point. We think about that in leadership of when there's a problem, we have to kind of be rational and say, what is this situation that I'm in right now? What's the hurdle in front of me? What's the reality? And it's amazing how much we can psych ourselves out
Mhm.
or I hate to say lie to ourselves, but
Mhm.
we're trying to protect ourselves from bad news. The first step is really being able to assess the reality of the situation. And that starts with admitting that there is a chance that we have some vulnerability
Yep.
and that we need help.
Yeah. Now, that is so good, and Zeest, I'm glad that you shared that, because too often, um and you and I kinda talked a little bit about this, offline in terms of we we know something's happening, but there oftentimes the reality hits us in a crisis, and it doesn't have to because we know something's wrong. We know something's off, but it's this delay or wishful thinking that we can wish it away, and never coming to terms that we may be dealing with something that needs immediate attention. So we just kind of keep putting it off. And I bring that up because men suffer from this a lot when it comes to their health. They avoid the annual checkups and they could be hurting. They could just be hurting and they feel like I'm a man. I should just muscle through it. I don't need to tell anybody that I'm dealing with, this issue. But I think that it's denial. And then I think it's miseducation and misinformation because sometimes you can actually perhaps maybe avoid something that could be far greater if you just take the time to acknowledge something's off. Let me go investigate, research, check it out, see what's going on, as opposed to just kind of kicking the can down the road until a crisis occur, you know?
Oh, you've brought up so many great and important points that I have been reflecting on these last few years. Not only is there misinformation, but there's a lack of information
Yep.
because we don't talk about it
Yep.
even among ourselves. What you had gone through in your health, the questions you had, the obstacles you faced are more common than people admit. And when we don't talk about illness and the need for health maintenance, much less medical interventions, then there's a shame component that comes in. Um, and then, with the other part of it, of like the gendered part, there's, you know, quite a bit of misogyny associated with these chronic conditions, which I have learned has led to, is one of the reasons why we don't have better solutions for long COVID today. Because these are typically like vague symptoms that don't seem to make sense to the typical doctor. It's not something that we learn about in medical school. So you're tired.
Yeah.
So get tough
Right.
is the
Right.
answer, right?
Right.
So you've got this thing, you're hurting, you're in pain. tough it out.
Mhm, mhm.
You're stressed. That's another one. You have anxiety. Those are really gendered things that are bad for women and they're bad for men
Yep, yep. That's a good point.
because they're associated wrongly with weakness. And the fact of the matter is, this is not a moral failing. Being ill is not a moral failing. It's actually quite a strength to say, I'm living in reality. I have a human body. I am fallible. I am vulnerable. I have the same body everybody else has, and this body needs to be tended to.
Yeah, yeah. No, that is so true. I was thinking about I mean, you've shared so much and your story is so powerful, but I'm thinking about the mental and psychological aspect of perhaps what you may have been dealing with because you are a physician and you were trained to serve and help people with issues relative to their health and what that burden might have been for you just because of the profession that you were in and now you're sick. I mean, how is that working on you from from a mental and perhaps maybe even an emotional standpoint?
I'm smiling because it's a big deal. And I'm not the only one going through it. Doctors, we don't have a job. We don't even have a career. We have an identity linked to this. Like most of us are in our 30s before we start practicing after our training is complete, by the time our training is complete. And um, it shakes you up when that identity is disrupted. Um, because, it's something you've been doing for a
Mhm.
whole life, it's something that you value, but also there's this deeper thing of, like, am I valuable only because I'm productive? Am I valuable only because I'm a doctor? And if I'm not that, if I can't do that thing anymore, does that mean I'm worth less? Does that mean I'm worth less? And I've started a podcast and a newsletter. I hear to talk about long COVID, and I hear from people who are also physicians, other healthcare professionals, and like professors, people in tech, all sorts of people who are struggling with the same physical condition, but also the same psychological condition. So it's an opportunity for us to revisit our bias maybe
Yeah.
to understand what is really important to us, what brings me value, what makes me valuable. How can I love myself
Mhm.
through my illness,
Exactly.
through this body, Those are really big questions, and when you're stuck in bed
Yeah, yeah,
staring at the ceiling, it's almost torture,
yeah,
to
yeah,
think through these things. These are things we wanna avoid thinking about, but that's what comes up.
because one of the things that stuck out to me when you started talking about this earlier is your profession changed. What you were doing as a doctor changed. And I can only imagine how because most of us, whether we want to acknowledge it or not, we are closely tied to our careers. And if you've been doing something long enough, you kind of begin to assume an identity from it. And your true identity is perhaps buried or lost because this is what you are known for. You are a doctor, you're a lawyer, you're a great businessman. And if something happens where you have to pivot or shift, then there seems to be a portion of you that's lost because your identity was tied up into what it was that you were doing. And a lot of professionals, especially high performing professionals, they deal with this when they are confronted with a crisis where they have to shift, not because they want to, but because of the circumstances. And then now you deal with the question of who am I? You know, I can't do this thing anymore. So what do I do now? And I bring that up because I realize that in addition to the physical challenges that you may have been dealing with, that there was a mental component to this. If someone out there that's listening that's suffering from fatigue, chronic fatigue, they don't know what it is. Um, they go to the doctor's not sure what it is. What do you talk to someone who may be experiencing some of these symptoms? And is the medical profession, in your opinion, are they adequately equipped to be able to pick up on these things at this stage to perhaps help folks identify should they go and talk to their medical provider about it?
So the answer is yes, you should talk to a medical provider about it, but the answer is always also to one of your other questions. No, the medical system is not equipped well enough to recognize, diagnose, and treat long COVID yet. And that was talk about another, like, psychological attack
Right,
where
right.
the field that I dedicated my life to, that I gave so much to, couldn't show up for me, wasn't equipped to handle, didn't have answers for me when I needed it. And that's what people all across the country are facing right now. People are being dismissed, told that long COVID doesn't exist, even though there's an ICD-10 code, there's billing codes for
Right,
it.
right,
So,
right.
if you can bill for it, then it definitely exists. Um, they're being told to deal that this is from anxiety, again, that this is a psychological disease. And the fact of the matter is, this is a physical condition that is very damaging to our psyche, especially when you're being told that it's not real or you're being gaslit, essentially. So there's a lot of missteps that medicine has taken so far. There's a lot of holes that need to be filled. But at the same time, our healthcare system is so powerful and has so many resources, so many treatments for the conditions and symptoms that occur from long COVID that there's no reason people should be suffering without any treatment.
That's right.
We might not have a cure for the underlying condition. We don't even have a way to really, like, there's not a biomarker, there's not a lab test you can get that'll tell you that you have long COVID. Um, but we have to believe ourselves. Our doctors need to believe their
Yep,
patients
yep.
and follow symptom severity and progression, and then meet the needs of their patients with the tools we already have in our arsenal. So, like, you have asthma. There's really powerful asthma medications, like keep going up the ladder and get relief. You have trouble sleeping. There's a lot of interventions we have and resources we have, and there's a lot of science behind sleep interventions. Apply that.
Right.
The same goes for like GI issues and headaches and all of that. And so there's no reason that someone with long COVID should just be told there's nothing we can do for you. And yet that is what is happening far too often and is my mission now to convince patients that there is hope and convince physicians that there are ways that they can help their patients better.
No, I love it. I love what you're doing. It certainly sound like it's something that's really needed. But Zeus, when you were a doctor, when you were practicing, um, there was a there was a way you viewed the healthcare system as a practicing doctor. But did your view change about the healthcare system when you became a patient, and how so?
Yeah, my view of medicine changed a lot after becoming a patient. I was calling myself going from a full-time doctor to a full-time patient. I was utilizing healthcare in a very different way now, going from someone who was providing healthcare to someone who needed healthcare. And there were things that I understood, realistically and mentally about healthcare, that there is health inequity that follows racial lines, that follows socioeconomic lines. There, physicians are human beings who bring their own misconceptions and biases and worldview into their practice. Um, but even then, I was really surprised by the few times that I was misunderstood by my doctors, um, and the ways that my doctors would sometimes say, like, "I don't know what I don't have anything for you."
Yeah.
Um, so, I grew up with a lot of exposed to a lot of chronic illness in my family. So I had been a patient advocate essentially. I didn't know what that word was, that there was a word for it, but I had been a patient advocate for my whole life essentially. And also the one who would translate as my medical experience evolved. I'd be the one translating what the doctor said to my family member. And so I have always had exposure to both worlds. And what I saw was that patients weren't getting what they needed from healthcare, but also physicians were not satisfied with their jobs as much. And we see the rates of healthcare worker burnout, exponentially increasing right now. And that's not surprising. Doctors want to be able to take care of their patients. They want to be able to make them feel better. And what I'm seeing is sometimes there's this like gut reaction of denying the patient's symptoms because maybe they don't know what to do for them.
Right. Right.
It's like it seems so infantile almost. I hate to drag my colleagues, but you feel hopeless, you feel powerless, and I was seeing this, like, powerlessness on the patient side and on the doctor side. And I was like, we can do better here. Doctors, you can admit, "I don't know what's going on with you." And a lot of doctors, it was hard for them to say that. And so to answer your question about the way my view of medicine has shifted, it became so evident to me that through our training, we as doctors are taught that we need to know the answer. And if we don't know the answer, then we get punished. And so now we're faced with a reality after COVID has come on the scene, that there are conditions that we have to actually say, I don't know.
Yeah.
And that's uncomfortable for
Yeah.
us. So until we sort of resolve and deal with that, it's going to be hard for patients to get what they need. It's going to be hard for doctors to get what they need out of their work too.
That is such a great, great explanation and overview of something that I think most of us who go to the doctor on a regular basis perhaps have experienced where they're and I'm thinking of an example, Zeus, when I went to this was back when I was weighing over 300 pounds and I was telling you offline I had all these health conditions and stuff. And so my doctor, man, I got a great doctor. I mean, she's great. Been with her for a long time. But at some point I realized that maybe her hands were tied, and let me explain what I mean by that, just to kinda maybe give an example, to what you're talking about. So I've been going to her for years, and she's been telling me, she said, "Hey, you got this problem, blah, 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 all these problems," right? And I'm like, "Well, what I'm supposed to do about these issues, right?" So you give me the medication, I'll take the medication, blah, 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 but I still got the same problems. I noticed at some point that she really couldn't give me anything specific except You need to exercise, probably lose some weight. Okay, well, how do I do that? I've tried losing weight a million times and it failed. So what do I do? But I saw the struggle of trying to come up with an answer that she probably couldn't come up with, and it seemed like she felt the need to do something or say something, but it still didn't help as far as from the perspective of what I was looking for. I mean, the medications and all that stuff helped, but for just why I'm here and why this problem exists, I noticed that it seemed like her hands were tied. So I mean, over the years, I've seen a more of a shift and kind of piggybacking on a little bit of what you were talking about, just in on both sides of the fence, where we as patients are not educated enough and accountable enough for our own health. So, and then we put perhaps maybe the onus on the doctor to tell us every single thing. Um, but some things like you may mentioned earlier, you know your body. I mean, you know when you're feeling off, you know something's not right. Um, you got to acknowledge that, but you can't think that they're going to be able to fix every single thing you have. And I don't think they can believe that they can fix every problem that you have because the system's set up a little differently. You know?
Yeah, I do. And I think what you're speaking to is this disconnect or like a lack of understanding how to collaborate
Yeah.
with each
Yeah.
other.
Yeah. Yeah.
So I have learned about so many different parts of medicine that I didn't even know existed
Really?
before I got sick.
Wow.
I didn't know how many different ways speech and language pathologists, speech therapists are trained. I didn't know different types of physical therapy. I didn't know what audiologists did. I had never worked with a dietitian. And what I am learning is that there are so many resources in healthcare that we as doctors don't fully understand. And so, if we don't even know they exist, we don't know how to pull from them. And instead, again, it's coming back to this idea that we have to have the answer and it ends with us. And that's just that paradigm is not helpful anymore.
No, you're right.
It's not pertinent anymore, and it actually puts too much on our shoulders as doctors.
You're right.
So instead, I think where we're moving in healthcare is one where, if we can spend less time charting on these computers that we're,
Yep.
answering to,
Yeah.
we'll be able to, harness the power of these allied health professionals and be able to be more comfortable in saying, I can offer you X, Y, and Z, but maybe this other person could help you implement that.
Right. 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 Right.
And so it's this implementation part that we as doctors don't get training in. We can tell you to lose weight. We don't know how to teach you
Right.
how to do
Right.
that.
Right. Right.
We
Right.
don't know how to hold
Right.
your hand through it.
Yep.
We just don't know. But guess what? There's a whole field of medicine, people who are certified professionals who have licensed medical licenses, um, who can who have more insight into that. So we have this, like, segmented healthcare system that we don't know how to harness and bring together, and I
Mm.
think that's what you're speaking to
Yeah.
of, like,
Yeah. Yeah.
where can I go to solve this problem?
Yep.
I don't see it yet, and I think
Yeah.
people with long COVID or people who have complex medical conditions, like, multiple specialists, we don't have a home base
Right.
to be
Right.
like, where can we fully understand the big picture?
Yeah. No, that's a really valid point that you just made there. And I mean, there's so many components to the healthcare system, and you've kind of covered some of these things that I think just adds tremendous value to us. When it comes to kind of better understanding the interworkings, so to speak. So you've done a great job in really helping us to understand more about some of the challenges that exist. However, we still have one of the best, healthcare systems in the world, and we just like anything else, it's a work in progress where you make changes and things of that nature. But before we get into how you began to recover, the road to recovery, and I want us to talk about that, and I want us to talk about the great work that you're doing now from educating and informing and the podcast. I wanted you to talk a little bit more about that in a minute. But tell us what patients are facing right now when it comes to medical gaslighting. What is medical gaslighting? Just curious.
Yeah. So, medical gaslighting refers to being dismissed or denied by their healthcare team. So, medical gaslighting comes from a term from a play in which a kind of terrible husband tries to convince his wife that she's going crazy by dimming the lights that were at that time
Gas,
gaslit,
right.
turning down the lights little by little every day, and then when she noticed that was happening, he would be like, "What are you talking about? I don't see that's all in your head."
Right.
So, it's convincing someone who has legitimate concerns that they're making it up, that they're not seeing what they're seeing, that they're not experiencing what they're experiencing. And people with illness experience this in the healthcare setting when they interact with a healthcare professional who denies their symptoms.
Got it. Wow. That's something. Now, when you were dealing with this, did you, I mean, I'm sure you were trying to find answers yourself, and this was the early stages where, this happened to you and there wasn't maybe a lot of information out there. Did you fall prey to any type of scams or just like misinformation? And if so, what type of situations did you run across?
Yeah, at that time, there continues to be medical scammers. There
Okay.
are medical opportunists all over, which is one of the main motivators for me to start talking about my long COVID experience, was because I was swindled by someone with great credentials, and when you're desperate, I just lost some money. It clicked pretty quickly that this was not what I thought it was gonna be. But people lose money, they have moral injury, like they have get their hopes up. They think this is the answer. They invest emotionally only to get let down. And they lose time that could be spent on more reliable and safer treatments. So there are many medical scammers out there. Did a whole episode, more than one, about how to recognize pseudoscience.
Yeah.
But it's, one of the traits is this all or nothing type of thing. And, if someone tells you medical experts don't want you to know, they're hiding
Yeah.
information from you, like there's some conspiracy, like we're too busy to make a conspiracy. Conspiracies take a lot of energy
Yeah.
and we're all drained. Everybody's trying to pick up their kids from daycare on time. We don't have time to uphold a conspiracy. Nobody's hiding anything. Someone's telling you that only they have the answer. It's sort of too good to be true, but when you're desperate and you've just been hitting wall after wall or been told, "No, there's no hope," then it is easy to believe in something that offers a solution. So, I'm a Stanford trained doctor. I have fallen for medical scams. I'm a Stanford trained doctor. I have been gaslit by other physicians. If it could happen to me,
Yeah.
it could happen to anyone.
That's a very valid point. Very valid point, and I'm glad you shared that. Um, Man, it's such valuable information that you are providing today, Zeest. I wanted to ask you about the moment. you went through the scams and you're dealing with a lot of this other stuff where your hopes were built up. What was the moment you realized that you started making some forward progress to transitioning out of this? Can you tell us at what point that was throughout the journey?
It's a great question. I don't know if there was one point where I thought, "Oh, I'm getting better now." It was a real slow burn,
Okay.
and I think what has actually helped me is to not get too bogged down in the details of my day-to-day functioning. And what I recommend to my listeners is to take a broader view and kind of check in with yourself over periods of time. Because what happens with a condition like long COVID is your heart rate has changed. Your GI symptoms might flare one day to the next. And if you spend a lot of time looking at your heart rate monitor and kind of, I see people looking at their heart rate monitor before they eat, right after they
Yeah.
eat,
Yeah, yeah.
when they get up, when they lie down. And doesn't it kind of confuses the picture. So I think my key, I don't know if this is answering your question totally, but what I can say is that the keys to my recovery was taking a broad view of my symptom timeline and recognizing I'm going to feel weird day to day. I'm going to pay attention, but I'm not going to get consumed by what happens day to day, which is easier said than done.
Right,
I
right,
recognize
right,
that.
right.
And then to approach my recovery symptom by symptom. And not everybody has this approach. We want to find a cure or a treatment for the underlying cause. The fact of the matter is, we don't know what the underlying cause is, much less have a treatment for the underlying cause. And that's maybe a trigger or a red flag for medical scammers who tell you we treat the underlying cause. Even if you say, like, the underlying cause is inflammation, fantastic. There are hundreds, if not thousands, of pathways that fall under the category of inflammation in
Right,
our body. Which one are you talking about?
right, right.
Um, and so in it kind of clicked for me that I was going to take this approach one day after a medical visit where someone once again told me they didn't know what they could do for me. um, I thought to myself, well, how do I treat patients in the operating room? So I deal with open heart surgery, a lot of emergency cases, even a lot of trauma. Um, it's a very dynamic situation. It's a very high stake situation. It's a very high risk situation. A lot of things are happening at once and things are changing very quickly. I have been trained to take action when lots of things are happening and I can only do one thing at a time. And so that works.
Yep,
That saved lives.
yep.
And I said, that's what I'm going to do with my own approach. I don't know how to cure the underlying condition, but boy, do I know that there are asthma treatments. And I couldn't breathe at the time. I couldn't lie down at the time. Let me get my breathing under control. Let me follow that pathway and get some relief. And then the key that I do in the operating room is prioritize the bad things. What's the worst bad thing? And that's what I did with myself. And so I tackled the worst bad thing one at a time. And that required me to not only accept that this was going to take a lot of time
Mhm.
and it was going to take a lot of specialists, um, but it was also going to take some patience on my part and accepting a little bit of uncertainty. So that uncertainty tolerance that I have been trained in helped me. And of course, I can't deny, my understanding of medicine and my understanding of the healthcare system
Yeah.
certainly was my advantage. And now, I want to share what I know so that until we get a cure to this or we get some standardized therapy, that everybody has some of that advantage too.
No, that's I mean, that's phenomenal, and you're right, because 'cause I'm sure there are people out there, they don't have anywhere to turn to. They don't know what to do, and they're just suffering with the situation without a lot of information and help, and that's why what the work that you're doing is so critical. When did you actually make the transition, Zeus, to focusing on serving people in this new capacity by providing information, encouragement, help, resources to folks that are dealing with long COVID?
So I started my podcast, Long COVID MD, in October 2023. I was having so much cognitive impairment, or what we call brain fog, that my 9-year-old at the time helped me turn on my computer and open GarageBand to
Wow.
teach me how
Wow.
to record. And I was motivated by a bit of that anger from getting swindled.
Mhm.
And um, the other motivation was that I recognized that when I had faced times of uncertainty and sort of fear in the past, or when I had hardships in the past, I dealt with it by myself, again,
Mm.
fiercely independent.
Right.
And there was a shame component in that I wanted to overcome by sharing my story, because in the past I had learned after my hardship had been solved that there was probably an easier way if I had collaborated with someone. So I wanted to take those lessons and not make the same mistakes and sort of reach out, use my voice to just talk about what I had been experiencing and the way that I was navigating my illness.
Mhm.
Um, and it evolved into a platform where I am sharing information about common treatments that are being used for people with long COVID. And more than that, and also the research that's evolving, day to day.
Right.
But more than that, I want to teach people to how to make medical decisions that are difficult, how to make medical decisions when you don't have a crystal ball. Because that, I think, is really the key to accelerating our recovery and reducing the mental strain that this condition really brings. It's so stressful to feel like you have to learn so much about medicine, you have to understand science, and then you have to make the best decision because there isn't anyone to tell you what the best decision is. So we have to trust ourselves. And so, more than anything with long COVID MD, I'm trying to teach people how to think like a doctor in a difficult situation. And I called it long COVID MD to circle back to our conversation at the top of this, because my medical business was called Zeest Khan MD. Nobody told me that's not a great idea to name your business after yourself, but it was Zeest Khan MD, and that was my identity.
Yeah. Yeah. Yeah.
And so now my identity is shifted to long COVID MD. It was a way to remind myself that I'm still a doctor,
That's right.
that I can still help people, that I still have some information. And as my voice got stronger, because it literally was damaged, as my brain started to come back because it was really damaged, and it still is, I'm kind of waning, sundowning here towards the hour of us talking.
Yeah. Yeah.
But as that got better, I was like, whatever capacity I have, I want to share that with others and push that forward into the world to make somebody else's effort a little easier and to make them know that there are a lot of people going through this and that they are not alone.
Now, I got to tell you, I have been totally immersed in your story, and you've done such a marvelous job and taking us on this journey with you because it's not often we get a chance to see it from both sides. I mean, you 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 your profession as a physician and having the experience there and then having the problem that comes sometime with patients and being on the patient side. It's a pretty unique vantage point, I'll say. But an incredible journey, an incredible work because you didn't stop doing what you went to medical school for per se, and the work that you've been doing and servicing and helping people. You just found a new way to do it. And I think that's incredibly incredible. It's incredible in and of itself because you didn't allow the situation to stop you from being in that space where you could help other folks. And I got to commend you for that, Zeest. I mean, like I said, I've just been immersed in your story. I could talk another hour with you, but I'm not going to put you through that. It's just been really great learning about what you're doing. But as we get ready to wrap up, let me ask you about this. For people who may be wanting more information about your story, your journey, and more information about dealing with long COVID, what are some of the best ways for them to reach out to you?
First, I want to thank you for your kind words. I was getting emotional listening to them. I think, what I'll say before I sort of plug my platform is that when you hit a wall in your physical capacity in your career, you can either decide to disappear
Yeah,
or pivot.
yeah,
And I want to remind people whose identity has been shaken, whose abilities have changed, that even though your abilities might be different now and you might access different things, the skills that you have learned through all of your previous identities, those
yeah,
come with you.
yeah, yeah,
Those help you problem solve. Dig into your resources that you have used before. Identify resources that you haven't tapped into. People, you know this better than anybody. People are your most powerful resources. And I hope I can be one too. So longcovidmd.com is my website. You can learn about long COVID. You can access all of my audio podcasts and YouTube videos. You can sign up for my newsletter that's hosted on Substack. There, I write summaries that are easy to read. They're brain fog friendly
yeah,
summaries of each episode. And those are things that are easy to share with others. For members of the Substack, we're starting to host small group workshops, webinars, live streams as a way to build a community. There are a lot of long COVID communities and chronic illness communities. My little corner, like I said, is a way to talk to a physician who's going
mhm,
through this, not giving specific medical advice, but talking about how healthcare works,
right,
what
right,
science, really means when it comes to medical treatments and how research is evolving. I've gotten a chance to speak with lots of amazing scientists, researchers, and people who have long COVID and other chronic illnesses. Um, Pretty soon, we're launching a coaching package for people who want
nice,
more one on one guidance. There
yeah,
is a need for physicians who fall ill. Again, there's a lot of like shame and confusion. You don't really want to admit
Mhm.
to your workplace that you might be going through some stuff prematurely. But you want to talk to someone without it getting on your medical record,
Right,
just
right.
to have, again, some guidance to think through your options. Again, not medical advice. And also for people who are non medical, what I call normal people,
Yeah.
because we are abnormal,
Yeah.
um, who want more guidance one on one. With long COVID, every person is different. And so it really helps to work with someone one on one. So if you sign up for the newsletter at longcovidmd.com, you can find out when all of that launches. And yeah, I'm on YouTube and all of the podcast platforms.
Oh, nice, nice. Very good, very good. I wanted to ask you this, Zeest, before we finish up. Now, we didn't get a chance to talk about like other chronic illnesses. Do you cover any of this, or do you have resources that could point people in a direction if they're facing another, if they're dealing with another type of chronic illness?
Yeah, that's a really great question. Long COVID has a lot of overlap with another infection associated chronic condition called myalgic encephalomyelitis. It's abbreviated ME. It's also called chronic fatigue syndrome. There is a lot of overlap with fibromyalgia, rheumatoid arthritis. Diabetes is an issue after COVID. And I am someone who landed here in the island of long COVID and recognize that I'm not the first person here. My my interest lies in the overlap of why are we here? How did we get here? Why don't we have a life raft yet? The answers are very similar from one condition to another. And so I bring in voices of people with other chronic conditions to learn the wisdom that they have and what has worked for them in living fulfilling, joyful lives, even if you have a
Yeah.
medical condition.
Yeah. No, that's good stuff. That's good stuff. You shared so much. I was going to ask you if you wanted to leave any words of wisdom or encouragement to some folks out there who might be dealing with chronic illnesses or long COVID.
I think I'll say to them what I can say to myself right now as my fatigue kicks in, to be patient and to have grace for yourself. My family upbringing taught us that your body has rights over you. And so it is our responsibility to take care of this body as best we can. And so instead of feeling ashamed of your limitations, take it as a responsibility and a duty to tend to carefully and with grace and with a lot of forgiveness for yourself because you've done nothing wrong
That's right.
and you deserve help.
I love it. Love it. Dr. Zeest Khan, folks, thank you for coming on the Well to Lead podcast today. Zeest, I really, really thoroughly enjoyed our conversation and the value that you have provided in this short time that we have had this discussion today. So I really appreciate it. Really
It was
appreciate it.
such a pleasure to be here and talk with you.
Thank you so much. Well, folks, that's all we have for you guys today. Certainly appreciate you tuning in. And until next week, you guys have a good rest of the day. Take care and bye bye.